your corrections. Do you want it immediately?
Yep.
Okay. So, have you prepared a topic for today, or do you want to have free talking?
I prepared the article.
Mm-hmm. What article is that?
Actually, I read two articles. One is
Mm-hmm.
for the tattoo, about the
Oh,
tattoo who got disease.
eyeball. Mm-hmm. Eyeball tattoos. And
Yes.
then,
And the music during the operation.
oh, the music during operation. So, what topic would you like to talk about first?
Operation during.
Oh, operation during music. So,
Yeah.
what do you think? What do you think about the surgery? Is it? I find it kind of weird. So,
Mm,
how about you? Do you find it? What are your thoughts about the
mm,
surgery?
I think that it is possible
Mm-hmm.
because
Actually,
yeah.
uh-huh.
I
So okay, okay. Go
okay.
ahead.
I think
Mm-hmm.
that the patients will be. I'm not sure, but patient will be very comfortable, like
The patient
comfortable. Yeah, patient,
will be
patient.
very mm-hmm,
Mm-mm.
comfortable.
Yeah, during the operation, so it works.
Yeah.
Mm-hmm.
Yeah. So it worked actually. And hold on, I want to share you. Actually, I've read this a long time
Mm-mm.
ago.
Me
Really,
too.
it
Mm-hmm.
happened last February,
Mm-mm.
and it. Hold on, I'll share the link to you. Okay.
Mm-mm.
There's an article on the internet that shows this story. So this is her actually. Can you see the picture?
Yes. Oh.
Yeah, that's how it happened. Okay.
Oh. Amazing.
So yeah, she was playing the violin
Mm-mm. Mm-mm.
while she was being operated in the head.
Mm.
So yeah, do you know why um they needed to keep her awake
Oh.
during the operation? Can you tell me why?
I don't know.
Okay, I'll explain it to you. So the
Mm-mm.
reason why she
Mm-mm.
needed to play the violin
Mm-mm.
while she was uh, doing the surgery,
Mm-mm.
the reason why that happened is because if she was asleep and
Mm-mm.
they had the surgery,
Mm-mm.
there is a possibility that when she wakes up, she won't be able to play violin anymore.
Oh. Okay.
So, did you understand that?
Mm-mm.
So, because it says here that they first mapped Miss Turner's brain to
Mm-mm.
identify areas that
Mm.
were active when she was playing violin. So
Ah.
basically, the surgeon,
Mm-mm.
Professor Ashcan,
Mm-mm.
the doctor,
Mm-mm.
um, thought of a plan
Mm-mm.
to um, see the
Mm-mm.
parts of her brain that
Mm-mm.
helps her play the violin.
Mm.
So there are certain parts in your brain that
Mm.
tell you to do things, okay?
Oh, okay. Oh,
Right?
so I
So,
got it.
hmm so in the nervous system, if there's a part of your brain that is active, it means that
Mm-mm.
you're doing something. For example, I am moving my hands right now, right?
Mm-mm.
There might be a part of my brain here
Mm.
that is helping me move my hands.
Mm.
So if those parts of her brain, Miss Turner's brain, if parts that were active when she was playing violin, if there were parts that was touched or was damaged,
Mm.
she won't be able to play. Did you get that?
Yes.
Okay. So yeah, that's the explanation why she had to be awake.
Mm-mm.
hmm So anyway,
Mm-mm.
um, Would you like to see this happening in real life?
Would you like to see this?
Yeah, this operation. Would you like to watch this in real
Uh,
life?
I don't want to watch this
Why?
because um, mm, I think that if also there is a patient who needs this kind of
Mhm.
the treatment, then of course I highly recommend them to do it.
Mhm.
But I think that it is kind of dangerous because what
Mhm.
if the patients all of the sudden awake
Mhm.
then during this surgery? Then it
Mhm.
is very dangerous and she
Yep.
got a lot of pain.
Actually, no. And by the way, earlier you said, what if the patient is all of a sudden awake?
Yeah,
You could
awake.
say, what if the patient
Mm-mm.
wakes up all of a sudden?
Wake up all of a sudden.
Yeah,
Mm-mm.
that's that's better because it's kind of hard to understand and it's kind of
Mm-mm. Like,
jumbled. You
mm-mm.
said it earlier, but I fixed it. So let's
Mm-mm.
just say, what if the patient wakes
Wake
up
up,
all of us
wakes up.
wake wakes up all of a sudden?
Yep.
Okay,
Mm-mm.
okay. I believe that you understood that. So I'll answer your questions now. Okay, Sunny. First of all, she didn't feel anything. She was awake. Okay,
Yeah, I think that
but
she was okay
she
then
was.
she got how can I say that
Mm-hmm.
she cannot feel any pain during this surgery. Like
Yes.
but she
Actually,
didn't sleep. Like I
yeah, she
forgot the
didn't sleep.
word how to call that. Like parts.
Anesthesia.
Yeah, I need
Yeah,
yes.
she was that what you're going to talk to me
Mm-mm.
what was that the word that you were going to say, or
Mm-mm.
you have another word to
I
say?
mean, it is not sleep, but she's still awake, but
She's still conscious.
she's still conscious.
Yes.
She still have conscious, has conscious,
Actually,
consciousness.
she's really conscious, and she's
Uh,
also playing the violin
mm-mm.
while
This,
while her head is opened up. So, um, second of your second question that you had earlier is if she was feeling pain.
I mean, she just got injured only for her brain, so she cannot feel only for brain. So she can
Yeah,
feel our other part of her body.
yes, absolutely. But
Mm-mm.
while she was being operated, when you touch the brain,
Mm-mm. She
while
cannot
it's
feel.
she cannot feel.
Mm-mm.
That's right. That's right. She cannot feel. So,
Mm-mm.
uh-huh. So
But
they
I heard that
mhm
even though she got injured, that she
mhm
cannot that way she cannot feel anything about her brain, but she can. Um, I heard
mhm
that the
mhm
people. I heard that people felt any pain, but people felt some operation, like the sounds and how can I say that kind of the weird feeling on her brain.
mhm
hmm
yeah. So
So that's why doctor usually recommends the patients to do the sleep.
yes,
Mm-mm.
absolutely. So earlier you said I heard the people
Mm-mm.
feel some operation.
Yeah,
So
feel some operation.
so do you mean feel the brain
Like feel some operation, the
part?
process of the operation, like using the knife or the scissor, like they can
Mm.
feel, they can feel something touch their brain,
Mhm.
but there is no pain.
Yes.
Mm-mm,
So I heard that people felt
mm-mm, can
felt
feel
or can
people can
feel.
feel the
Hmm.
process of the surgery or operation,
Yes,
but yeah,
that's a better sentence.
but
So
yeah.
yeah, actually, yeah, they can feel what's happening on the operation.
Mm-mm.
Okay, and so I want to ask you a question, by the way, Sunny. Do you think that the right hand, I mean the left hand, is more important than the right hand when playing the
Mm.
instrument? It says so in
Um,
the
I think
article.
that depending on what instrument,
Mhm.
I I don't have an experience to play the piano, to
Mhm.
play the violin,
Mhm.
and these articles say that when it comes to the violinist,
Mhm.
they the left hand is more important than the right hand.
Uh-huh. Yeah,
Mm-mm.
but actually I agree with you when you said that
Depending
it
on,
depends. Yeah.
yeah,
So earlier you said I think that
it
depending that's
depends on
depending
it
on
depends
mhm.
on the instruments.
That's better. Okay. Very
Yes,
good. Actually, you know how to correct yourself. Good job.
yes. Mm-hmm.
So, yeah, you are absolutely right. Actually, it depends on the instrument, but still, I think for me, all instruments require two
Both
hands.
hand.
Yeah.
Yeah.
For example, the saxophone, right?
Mm-mm.
Saxophone.
And
Without the other
piano.
hand, and piano,
Mm-mm.
piano or the trumpet, you still need two hands for that. The
Mm-mm.
trumpet and the trombone, you still need two hands for that.
Yes.
Drums, drums,
Mm-mm.
two hands. So yeah, I think for the violin,
Mm-mm.
it's it's it also needs two hands because
Mm-mm.
the this hand holds the strings,
Holding
right?
strings,
The
and
notes,
the left
the bow,
hand we have
bow,
to grab some, how we
bow,
call
the
that,
bow.
ball.
Yeah,
Mm-mm.
the bow. So it's both important, right?
Yeah, both important.
So so do you find it weird that it says in the article that the left hand is more important? I think it's wrong.
Yes, I agree that.
Okay.
But we
So
are not, since we are not a professional
um
about the violinist, so
um
we are not
yeah.
sure about it is real or not.
Actually, Sunny,
Mm.
just to share it with you, I am actually a musician.
Oh, really?
Yeah. And
Oh.
my
Uh-uh.
wife
Uh-uh.
is also a violinist.
Oh, really?
Yeah. So
Mm.
I think so we both think that this is kind of wrong that the left hand is important.
Mm.
I think both hands
Is important.
is important to any instrument.
So
Yeah.
what kind of music do you do?
Oh, I play the bass guitar.
Oh, guitar.
Bass. Bass
Bass
guitar.
guitar.
So, yeah, I usually play at night when I'm not
Mm.
working here.
Oh,
So,
you're
yeah.
cool.
Mhm.
You're cool.
Oh, thank you.
Mm.
Actually, more busy than cool. I'm
Mm.
a busy person.
Busy person.
Yeah, I'm not
But
not cool.
but I think that you can earn the money from your ability of English skill,
Oh,
and
yeah.
also you can do what you like
Yeah,
during, yeah.
absolutely.
So I think it
That's
is good.
yeah, thank you. That is really fine too. So how about you? Before we continue with the article, how about you? What do you think? Do you want to play a music? Do you want
mm,
did you want to be a musician as well?
no. I
But
don't have any
mhm.
talent as a
Oh,
musician.
but have you thought you know, have you thought of
Mm.
seeing yourself playing an instrument?
When I was elementary school student, I also
Mm-hmm.
want to be a pianist, but
Oh.
mm, I lost my
Mm-hmm.
interest in playing the piano when I was,
Oh, you lost your interest.
yeah,
Oh, that's
15
kind
years
of
old.
sad. Yeah.
Mm-mm.
Actually, um, you're kind of like my mom, because my
Mhm.
mom actually lost interest with playing the piano.
Mm-mm.
But she still plays from time to time, but not too much.
Mm.
Right? Just for free time or
Mm.
just for fun.
Mm.
So yeah.
Yes, I think
Mm,
that only special person can be a musician
no,
because they
not
have
really.
some talents
Not
about.
really. No.
Mm-hmm.
But good musicians
Mm-mm.
really have
Yeah,
talent.
yes.
Yeah.
Yeah, Michael Jackson.
Yeah, Michael Jackson.
Mm-mm.
Hee hee.
Mm-hmm.
So you like Michael Jackson?
Yes.
Oh, really? So what do you listen to? What are your favorite songs from Michael Jackson?
Oh, I don't know.
Oh,
I, d- I
okay.
I'm not a big fan of the Michael
Mhm.
Jackson. I just heard
Oh,
that he is one of the greatest musician from all around the world.
yeah, he's the
Mm,
king of pop. Michael Jackson.
yeah.
He's the king of popular music.
Yes, and
Yeah.
I like his dancing.
His fashion?
Dancing like the
Oh,
moves.
dancing.
Mm-mm.
Yeah. Like yeah, like that. He
Yeah,
holds his
yeah.
hat like that.
Mm-mm.
Yeah, I kind of miss watching Michael Jackson because you brought him up. I mean, you talked about him, so
Mm-mm.
I kind of miss listening to him.
Mm-hmm.
I haven't listened to him for a while, so I'll try to listen later.
Mm-hmm.
So, by the way, I want to ask you about the idea
Mm-mm.
of having surgery while you're awake. So, do you
Mm.
think that? So, what are your thoughts about doctors discovering that you can do that?
Oh, discovering.
That you can do that. You can have surgery with an
Uh,
open.
piano or with the violin.
Mhm.
Mm, I'm not sure, but since
Mhm.
doctors study a lot,
Mhm.
and mm, I think the doctor really curious about
Mhm.
whether it is works or not. Like
Mhm.
during the surgery, if the patients are going to use the certain part of the brain,
Mhm.
mm, if the brain will activate
Mhm.
during the surgery, and it also can be activate after the operation.
Mhm.
So I think that most of the doctor already know about it from the study, but
Yes,
I think that
absolutely.
nobody try to try to do
Yeah.
this operation,
Yeah,
because
nobody tried to do this
yeah, because
operation.
there is the
Yeah.
risks.
Yeah,
Mm-mm.
actually there is a risk, but still um I'll explain to you
Mm-mm.
why they're awake.
Mm-mm.
So, um the the violinist here in this topic,
Mm-mm.
Dagmar Turner, as you can see, she's playing the violin, right? Um I think
Mm-mm.
while they're doing the operation
Mm-mm.
and while she was playing the violin,
Mm-mm.
um so they were touching parts of the brain, right?
Mm-mm.
I think some parts of the brain they can see, the doctors can see what part not
Ah, what
I think they
part
can
is active?
see the parts
Mm-mm.
that they don't need to touch or they must be careful with while she
Mm.
was playing. That's why she's awake. So,
Oh.
oh, okay, that's moving right now.
Mm-mm.
So that might be helping her play the violin. So
Mm.
we are not allowed to touch that. So
Oh.
so that's how they do that. Okay?
Mm.
Mhm.
Yeah, yeah, yes.
So it's
I see.
really interesting, right? So
Yes.
if I were to have a brain tumor,
Mm.
and I'm also a musician as well, right?
Mm-mm.
So I would have this. I would like to try this, so
Mm.
that I can still play.
Play the
I can still
guitar.
play the
The
bass
guitar.
guitar.
Bass
So,
guitar.
and
And
because yeah, um, the risk is scary.
Mm-mm.
Uh, when you're a musician and you
Mm.
really love music,
Mm-mm.
of course you don't want to lose the skill of playing.
Yeah, of course, because I think for the musician, music
Mhm.
is very big part of their life.
Yes,
So
absolutely.
if they lose the skills of that, playing the guitar or playing the violin, they
Mhm.
feel very sad, and they feel
Yes,
like they
absolutely.
lost all everything in his or her life.
Oh, yeah, absolutely. That's correct. So,
Mm-mm.
yeah, for me, if I lose my playing, I don't know what to do.
Mm-mm.
Um, I'm not really, I'm not really, uh, not to say that I'm not really a teacher, but this is my first time to teach.
Mm-mm.
But I really love music.
Mm-mm.
So, to have, uh, to not be able to play would
Mm-mm.
really make me depressed, or
Mm-mm.
probably quit life,
Mm-mm.
or not do anything at all.
Yes.
Yeah, cause I really love I really love my job.
Mm-mm.
Even this job, actually. I really love
Mm-hmm.
doing this too. So yeah, actually it's my first time to teach.
Mm-mm.
That's the real story from behind
Uh-huh.
me. I mean, that's my real story.
Yeah, yeah,
Yeah, I'm sorry, Sunny, for sharing too much.
yes.
I
It's
hope it's
okay.
okay.
Yeah, it's okay.
Yeah, and by the way, there's a term here.
Mm-hmm.
There's a term for the operation that happened here. So, as you can see in this article, it is called awake craniotomy. Okay? So,
Mm-mm.
it's a surgery where the patient is awake.
You
So,
may be worried that on awake will
yes,
hurt.
and
Oh.
mhm.
So yes, as I mentioned to you before, there is a lot of Risk.
Uh-huh.
Yeah, she cannot, like,
Mhm.
if this part will hurt, then she cannot
Mhm.
awake. Yeah, she couldn't awake. She cannot
She c-
awake.
she cannot wake up.
Wake up if
Yeah.
this part will hurt, get
Mhm. Yeah.
hurt.
Or
Mm.
she might lose the skill of playing.
Oh, then at that time it is very big risk.
Yes.
So I think that, but in my case, I want to try this, but
Mm.
my mother or my father will stop me
Mhm.
because they will think about the negative part, this the
Yes.
negative part of this surgery, and there
Mhm.
was if there was no um examples of success, for example,
Mhm.
then mm, I think that it will be very big risk for
Yeah, it
me.
will
Mm-mm.
be a very big risk, actually.
Mm-mm.
And hopefully that doesn't happen to you, right?
Yeah, I hope
Yeah,
so. Mm-mm.
no one wants that to happen to
Mm-mm.
anyone, actually. To have a brain tumor, it's a very
Yeah,
difficult thing to have,
yeah,
because the brain is very important. Brain and
yeah.
heart for the body, right? So
Mm-mm.
yeah.
But I think that thanks to her challenge,
Mhm.
there might be a lot of patients who got surgery,
Yes.
who played the violin or who played the bass guitar,
Yes.
during this operation.
Yes,
Uh-uh.
and hopefully they actually,
Mm-mm.
um the patient here,
Mm-mm.
Dagmar,
Mm-mm.
you can see here, 3 days after the
Mm-mm.
procedure,
Mm-mm.
the 53-year-old was well enough to go home to her husband and son. So
Oh.
right now she is very fine.
Mm.
Yeah.
Great.
So, so okay. And here, there's extra information here as well.
Mm-mm.
So, according to Cancer Council Australia, it is possible
Mm-mm.
to undergo meaning to have
Yeah, yeah, yeah.
the
I know.
surgery
Mm-mm.
while awake to have
Mm-mm.
a brain tumor removed. So, um, actually, the operation is approved and it is allowed uh, to be done to other people. So the
Mm-mm.
surgery is okay to do.
Mm-mm.
And so the operation known as awake craniotomy. The,
Mm.
this is the definition, by the way, of awake craniotomy. It's a
Mm-mm.
procedure sometimes recommended if the tumor is near parts of the brain that can control speech or movement.
Mm-mm.
Okay,
Okay.
so that's also one of the reasons why they had to do
Oh,
it awake, because
yeah.
she might not be able to speak or
Mm-mm.
move when they touch some wrong parts of her brain.
Mm-mm. Okay.
Hmm.
I'm very sorry to interrupt to you, but I have another class 30 minutes
Okay.
in 30 minutes. So, yes.
Uh huh.
I
Oh, so
think
you
that
want to
yeah, finish.
prepare.
Yeah,
Okay.
yeah, yes.
It was nice talking to
Yeah.
you, by the
Thank
way,
you.
Sunny, and I hope that you've learned something from me today, and I hope that you
Okay.
take care as well. Okay?
Thank
Bye
you.
bye.
Have a great day. Bye bye.
You too.